I think there's been over the years around football globally a lot of concern about whether there's a link between neurodegenerative disease and football. And many people have tried over the years to find ways of testing that, and none have been successful. We went out in 2017 with a request for tender to see whether science and data had moved on. And we received a really interesting proposal from Glasgow University, led by Willie Stewart, that said we have a digital database in Scotland which is unique, which is a combination of the medical records of all Scots and a digital database of all Scots who were professional footballers. Combining the two allowed them to see if there was a link between neurodegenerative disease and playing professional football for the first time. So it was never possible to do this research before this point. Well, both the PFA and ourselves were concerned to find out if there was a link. We're both concerned about the welfare of footballers, not just in England or United Kingdom, but globally. 211 countries are members of FIFA, so this is a global issue. And when this request for proposal received this innovative response, ourselves and the PFA decided to take the opportunity to say, is there something we need to learn, and what do we do about it? It tells us that professional footballers born between 1900 and 1976, when you looked at the outcomes for the cause of death, there were 3.5 times the incidence of neurodegenerative disease than the general population. We took nearly 8,000 professional Scottish footballers, compared them with a matched sample with identical demographics in terms of where they were born, how much they earned, what their health background, what their level of deprivation was. And the general population of 23,000 versus 8,000 professional footballers, the professional footballers lived just over 3 years, longer than the general population. But when they died, they had 3.5 times the incidence of neurodegenerative diseases. People genuinely tried to find ways, and the methodology and the data wasn't available to give any clear answers. For the first time ever, two things happened. There was a searchable database of medical records, and there was a database of professional footballers. Both of those existed in Scotland, so it was possible to look at the health outcomes of professional footballers versus the general population for the first time. That proposal was put forward in 2017. It was carried out during 2018. We've got the first half of the study which said there is a link between playing professional football and a higher incidence of neurodegenerative disease. It wasn't possible to do that research before. Nobody knows. What it says is it's established that people who played professional football in Scotland and were born between 1900 and 1976 have this higher incidence of the disease. The current level of research doesn't point to what is causing that link. Whether it's concussion, whether it's heading, whether it's heavy balls historically, whether it's the lack of concussion protocols historically, is not established by this research. And we need further research going forward to identify the link between given activities and their contribution to an increased incidence of dementia. Potentially, but not yet. We need to identify from further work and further funded research what the actual causes of these issues are. And then if there are any changes are necessary to the game, we will make them in conjunction with both UEFA and FIFA. So globally, if the game needs to evolve, we will evolve it. But today, all we need to do is to observe concussion management protocols and limit repetitive heading exercises. They're the only changes we're seeking to make. I would like to thank those affected and the families of those affected for ensuring that the impetus to get to this bottom of this problem has been maintained over the years. We've consistently tried to find a way to answer their reasonable questions about is there a link between professional football and dementia. For the first time with the novel research in Scotland, we've managed to get a clear answer to that, and a lot of the credit for the urgency to find the answer is due to them.